So I just want you to see after I took that torn portion out, there's a nice smooth transition to the front part of your meniscus here, and this is all stable in the back. I'm going to put the scope through the other side so you can see this better. But that tear went all the way back to this area, and that's why we removed that part. I'm kind of on a high power now, and then that comes out like that. It looks better. I'm going to just smooth a little bit of this surface off here. As we turn down, there's a couple little rough areas, like this one over here, that we cleaned out. But I'll turn this, well actually, get a little dizzy here for a second. I'm going to come out and come back in. And show this to you from this side here. Again, as we come back there, shaver, just so I have some suction in there. And that just shows you that area where the meniscus was torn and had to come out. I'm just kind of barely touching some of these little areas here. Let me get a picture of that. Hang on, let me turn that off. Get a picture, a still photo of that for you. Hang on. Then we'll come over here, kind of the probe. Come over here to where your ACL and PCL live. There's a little bit of stretch or partial tearing of your ACL, but it felt stable on exam. Here's your posterior cruciate ligament attaching up here and going posterolaterally. Your ACL is in front right here. There's a little bit of stretch to it, but it's still attached when I go to pull on it. If I look here towards the front of the knee, hang on, and we do a drawer test where I pull on your tibia to see how far forward. It's pretty darn stable. Now if we come into the, kind of the probe back please. If we come into the lateral part of your knee, which I'll show you in a moment. Hang on, let me just get my probe over here, and then let me also make sure I'm not on zoom at all. Some of this ACL synovium around the ACL is kind of pinching over towards the lateral, so I hold the probe here for a moment. And I'm going to need you probably to hold the leg. Hang on. Table down a little bit. Table down. And now we're on the lateral side. Any good? Table. Now we're on the lateral side of the knee. Let me just try to get in here with my probe and my scope. And this meniscus looks better. You can see it's all in here, no big tears. As we come around the front, that all looks good. Towards the ceiling. No. That way. Touch that spot on the ceiling with the foot. Bend the knee more. Like that, and go up like that. Perfect. So here, I'm guiding my assistant here. Here's a little bit of wear and tear on the joint surface of the tibia and the end of the femur up above. But as I'm pulling on this meniscus, the popliteus tendon's right back there, and I'm pulling on the meniscus above and underneath. It looks to be in good shape. I just want to get a little bit of this tissue that's pinched right here out of there, and also smooth off this area. There's maybe a little fraying. Actually, I think that's on the tibial plateau and not on the meniscus itself, but we're going to clean that up a little bit, and then I'll get a picture of that when we're done as well.